There are currently active alerts or outbreaks in 303 schools, or about 13% of schools in the province. Currently, these schools have a combined total of 867 cases since January 11th. Overall, we have detected 16 new variant cases in the province, thanks to our aggressive testing of the vast majority of new cases. This includes new cases linked to a school. We were informed today that there are now 2 cases of variant COVID-19 where in-school transmission is likely the source. I am aware of 7 classes in 6 schools overall where a variant case has attended while infectious, and despite rigorous follow-up, this is the first time in one of these schools that we have identified variant transmission occurring in that location. Health officials are responding and making sure that anyone who is at risk is in quarantine and being offered testing twice. We are being extremely cautious to protect the health of everyone involved and to limit any future transmission. Just as our currently dominant strain of COVID-19 occasionally spreads in school, we will identify occasional examples of variant transmission as we are sharing today. However, knowing about variant cases means we can limit further spread, and the majority of in-school exposures so far have not led to transmission. Fortunately, we continue to see a decline in our hospitalizations. I know that the restrictions needed to limit the spread of COVID-19 make it difficult to mourn in the ways we usually would. That is one of the reasons that today I'd like to talk briefly about mental health and self-care. The pandemic has made countless aspects of our lives more difficult than before. Every Albertan has been impacted in different ways. It's not surprising that the past year has taken a toll on mental health and well-being of many of us across the province, across the country, and around the world. It's now been over 11 months since COVID-19 arrived in Alberta. In many ways, we've each gotten used to parts of our new normal, wearing masks, physical distancing, washing our hands. But that doesn't mean these things don't continue to impact our mental well-being. Isolation, staying distanced from one another, financial hardships, remote learning, teleworking, keeping up with new information, and coping with sickness and death impacts all of us. Last fall, the Health Quality Council of Alberta released the results of a survey of Albertans' experiences during the pandemic. Its findings are not surprising. 70% of Albertan respondents reported feeling stressed out. 46% expressed loneliness, and more than half felt that their mental health had gotten worse. Similarly, a National Canadian Mental Health Association survey in December found 40% of Albertan respondents felt their mental health had deteriorated since the onset of the pandemic. Today, I want to remind all Albertans to take care of their mental health. The physical symptoms of COVID and the physical aspects of the pandemic are visible, but our mental health can sometimes suffer in silence. It's important to look after your own health and well-being. Try not to ignore, avoid, or suppress anxious thoughts. Instead, be aware of your anxiety and acknowledge when you're feeling anxious about a situation. Then use a strategy that works for you to address that feeling, whether it be exercise, talking to a friend or your doctor, or making sure you're getting enough sleep. If you feel like you need help, don't wait to reach out. No matter the challenge you or a friend or family member may be facing, I want you to know you are not alone. Help is available, and there are safe ways to get the support that you need. Mental health services and residential addiction treatment for those with substance use disorder continue to operate with the appropriate safety protocols in place to ensure that help is available while staying protected from COVID-19. Free, confidential, non-judgmental support is available 24/7 through a variety of service providers in the province and across Canada. For children and youth, there's the Alberta Youth Mental Health Hub online and the Kids Help Phone. For adults, there's Alberta's Mental Health Helpline, which offers around-the-clock confidential support. The Addiction Helpline also provides confidential support for alcohol, tobacco, drugs, and problem gambling. There's also Together All, a free online network that offers Albertans 16 years of age and older with anonymous peer-to-peer mental health services 24 hours a day, 7 days a week. Phone numbers and details about these services and other resources are available on ahs.ca/helpintoughtimes. During these tough times, it's especially important to stay connected with friends and family. This is absolutely the time to lean on each other. Helping others cope with stress through phone chats or video calls can help you and your loved ones feel less lonely or isolated. Each of us can also play a key role in supporting our family and friends. We can be there to listen, to offer advice, or to help connect them to professional supports. There is great power and compassion in reaching out to find out how someone is holding up during these cold, dark days of winter. Never underestimate the impact we can all have by showing others that we genuinely care, because it is more important than ever that we continue caring for each other in every way.